Hey everyone, welcome back to my channel. So last week we did fat soluble vitamins, vitamin A. So this week we are going to do vitamin D, which is also another fat soluble vitamin. And it is a well-known fact that it is produced by sun exposure, by the UV light. Also, vitamin D is really important to promote healthy bones, healthy and strong bones and teeth. It also plays a very important part in the immune function, as well as the inflammation in your body. Now, despite its name, vitamin D is actually not a vitamin, it is a hormone, or more like a pro-hormone. And it is essential to promote good calcium intake in your body. So it works, it basically puts the calcium back into the bones. So whenever you take vitamin D, you should be fortified with some sort of calcium. So calcium and vitamin D work together. Now, the recommended dietary allowance for an adult less than 70 years of age is around 600 IU or 15 mcg. And the upper limit for vitamin D is 4000 IU, which basically means that you have to take something around 600 to 800 IU a daily. And if you're taking a monthly tablet, then it should be a little bit more than that. Lakh unit injections, 6 lakh unit injections intramuscular. And if it's not too low, then the doctor will prescribe vitamin D3 tablets, and they can be taken regularly also depending on the dose, and they can also be taken once a week. Now, women above 40, they require a little bit additional vitamin D3 for their bones, and as we know that women they reach a certain age, they reach at menopause age where vitamin D becomes low because of the estrogen connection. And therefore, then at that time, women should start taking vitamin D3 tablets, or at least get a regular checkup of their vitamin D3 if their intake is fine and adequate. Also, during pregnancy, women need to take supplements. So they're like multivitamins prescribed by the doctor. There is a reason for that, because when you have a fetus in your body and like a baby in your body, the baby needs certain supplements for their fetal growth as well as the brain growth. Now, what is the role of vitamin D in the body? So now vitamin D has a very critical role in the bodily functions. Now, vitamin D, it promotes healthy intestinal absorption of calcium to make sure that there are adequate blood levels of calcium and phosphorus in the body for adequate mineralization of the bone. Now, in adults, vitamin D deficiency leads to osteomalacia, which is basically softening of the bones, and it also poor bone density and muscular weakness. Now, long-term deficiency of vitamin D can result in osteoporosis. Now, adequate intake of vitamin D is required for a good immune function, and a deficiency of vitamin D can result in autoimmune disorders. There's a strong link between vitamin D and autoimmune disorders like diabetes and asthma and rheumatoid arthritis. So it's very important to keep checking your vitamin D levels in your body and to maintain a good diet. Certain conditions do affect vitamin D deficiency. For example, the skin color. Now, pigmentation in the skin reduces the body's ability to absorb UVB light from the sun, and of course UVB rays are important to give vitamin D from the sun. The skin absorbs UVB light from the sun and then converts it into vitamin D. Now, people who work in northern latitudes or who work night shifts or work in like highly polluted areas, they do not get a lot of sun. They're not exposed to sun. People who are homebound, like housewives and people who work from home, so they usually end up with vitamin D deficiency as well. So they need a very good dietary replacement for that. Skin's ability to synthesize vitamin D decreases with age, so the older adults, they spend a lot of time at home and they need higher doses of vitamin D. Vitamin D is fat soluble. It requires the gut to use certain dietary fats to absorb vitamin D in the body, right? So if you have some kind of fat absorption deficiency or some disease, then it will result in vitamin D deficiency as well. Now, people who are obese, they also suffer from vitamin D deficiency, and people who have had a gastric bypass surgery, of course, the gut is not able to, maintain a healthy absorption of these fats, and therefore it results in vitamin D deficiency as well. Now, vitamin D deficiency does not really cause a lot of symptoms, but a chronic deficiency of calcium like hypercalcemia can result in hyperparathyroidism, where the parathyroid glands increase the level of calcium in the body and lead to secondary symptoms. Secondary symptoms will include osteoporosis, bone fragility, muscle weakness, muscle twitching. It can also cause bone pain and muscle pain. It can also result in certain cardiovascular conditions, autoimmune disorders, infections, pregnancy-related issues, as well as some cancers, for example, prostate and colon, as well as breast. Now, vitamin D in infants and childhood. Now, the infants require an adequate supply of vitamin D because that is a period of rapid bone growth, and therefore, if there's a chronic deficiency of vitamin D in infants, it can lead to rickets, which is basically a disease which causes softening of the bones and also malformation of the bones and joints. Now, vitamin D deficiency also causes like hypertension, like high blood pressure in children. And 2018 study showed that vitamin D deficiency in children caused arterial wall stiffness. The American Academy of Allergy, Asthma and Immunology, it suggests that a low vitamin D exposure can lead to an increased risk of allergic sensitization. For example, like children who live close to the equator, they usually have a lower incidence of allergic reactions or peanut allergies, and they usually do not require an epinephrine pen or epinephrine doses. Now, vitamin D deficiency in pregnancy. Now, if in 2019 review suggested that a vitamin D deficiency in pregnancy can lead to preeclampsia and it has a higher risk of a preterm delivery. There's also an association of poor vitamin D status with gestational diabetes, which is basically diabetes that is only during the time when a woman is pregnant, and the blood sugar levels go back to normal once you've delivered the baby. So, but that is also very dangerous. The sugar levels need to be managed at that time, and diabetes is treated like a proper diabetes at that time, gestation. There's also a link between adequate vitamin D levels and a lower incidence of asthma and allergy related issues with newborns, but there's more research that needs to be done and it's not conclusive. The majority of the people, they get their vitamin D adequate source of vitamin D from the sun exposure. But people who live in places where there's a lot of lack of sunlight, and there's not enough exposure to the sun, so they start to lack in vitamin D. They need supplements, and so we're going to discuss the dietary supplements now. Now, the following are the dietary sources of vitamin D. That includes the fatty fish like salmon, mackerel, and tuna, as well as egg yolks, cheese, beef liver, fortified milk, fortified cereals, and juices. Now, as we've discussed before, the ideal levels of vitamin D, so 1 mcg equals to 40 international units, and therefore the infants require around 400 IU of vitamin D daily, adults around 600 IU, and older adults like above 70, 800 IU, as well as pregnant or lactating women around 600 IU, which is international units. Now, we can also discuss vitamin D toxicity. So since we've already discussed the RDA levels, now if you are taking more than 4,000 international units, and eventually if you take like 6,000 or 7,000 IU units, then that leads to vitamin D toxicity. Now, vitamin D in excess can cause also hypercalcemia, which is also life-threatening. Hypercalcemia can cause calcification of bones, it can cause hardening of blood vessels, in kidneys, lungs, and heart tissues. So it is a medical emergency. Now, excessive vitamin D can lead to certain symptoms in your body like nausea, vomiting, diarrhea, constipation. It can cause headaches, it can cause loss of appetite, dry mouth, and a metallic taste. So my suggestion to you is to always get your vitamin D levels checked. If you feel that you are getting some bone pain or muscle pain and you feel fatigued, you should get your vitamin D levels checked, and if it's low, then the doctor will prescribe the medication, or it will prescribe a vitamin D injection so that you can get back to your normal health. So that's it for today. Next week we're going to do vitamin E, and so we're going to complete the fat soluble vitamins with vitamin K. So there are 4 of them, and if there's any additional information that I get or any research done, I will definitely let you know. So please do like, share, and subscribe to my channel, and take care for today.